Medicare, in its first inception, really tapped into Canadians' emotions. The Canada Health Act, in response to filling the gap, tapped into Canadians' emotions. I think the response that Canadians are having now to the battle that's going down in the United States taps into Canadian emotions. They object to the misrepresentation, mischaracterization of the Canadian system by a lot of the American opponents. I'm talking, by the way, about the real Medicare program in Canada, not the one that some of you might have seen being portrayed by insurance company lobbyists and some other, how should I describe it, political ideologues in the battle taking place in the United States. The commercials really have been quite hair-raising if you've been watching them. In fact, I just got back from a panel in Ottawa a few days ago where American congressmen were there and to listen to some of the arguments being advanced. But the commercial that really got me is the one that has an examination room with 3 people in it. The doctor, the patient, and the government bureaucrat shaking his head saying no to the doctor and to the patient. You know the argument. The doctors are going to be interfered by some politicians in between. Of course, they forget to mention that this is not the situation in Canada, and they forget to conveniently overlook that the majority of Canadians, in fact 86%, rate the quality of their health care system today as high and are extremely satisfied with their health care services.
All the polls show that Canadians' confidence in their system has not eroded. It's better, it's higher than it was 10 years ago. And we take it almost as a source of amusement and national pride that the Americans don't get it. And if they want to use our system as a whipping boy in their own propaganda wars, it's mildly irritating. It does harm Americans. I think that's the worst thing. It doesn't harm Canadians, it harms Americans. And we should hope for our American brothers and sisters that they get it right. But I, for one, don't much care about what right-wing superstitions Americans want to put out there about our healthcare system, because ultimately they're the ones who suffer from their own ignorance.
Our Canadian healthcare system costs about 10% of GDP, and it's been like that for the last eons, and it's predicted to be like that for the next at least 40 years. If you look at the US, it's about 15% of their GDP, and it's looking to go up to 18% in the next few years. So if you want to put it for an individual, Canada spends per capita about $300 per Canadian for our healthcare system, while the US spends $1,000 per capita. Just in the dollar sense, and us, everyone is covered. We don't have 1 million people with no coverage at all. So just in the dollar sense, it makes sense to have a public system, publicly financed, administered, and delivered. And then there's fairness. When I'm worried about my son or my mother, I know they will be taken care of regardless of their level of income. Nobody in the US can say that. And being a nurse, a lot of my friends went in the 80s, 90s when we had no jobs, they went and tried to work in the US. It was very difficult when you had to take care of a patient and ask for a credit card first or a health insurance card. We don't do that in Canada. We take care of you and we make sure that you're okay and that your family is okay.
We know that there are studies that emphasize the efficiencies of a single payer system, and of course we're always chastised about not wanting to look too much to the United States, but it's hard to ignore the largest for-profit healthcare market in the world, just south of us, where 31 cents of every dollar that's spent on healthcare goes to administrative fees. In our single payer insurance programs in the provinces, it's 1.3 cents.
One of the things that Canadian Doctors for Medicare really focuses on is an extension of the concept of evidence-based medicine that we use in practice to evidence-based policy. Don't go with the flavor of the day. Look at what has worked, what works best in other countries, what works best in your own context, and apply that. And certainly, do not be afraid of a collective approach to providing healthcare, because it has worked very well here. We have flaws and we have things to work on, but I think if you just look at the data, our outcomes are better, our patient satisfaction is better, and we actually spend a lot less money per capita doing it.
Every bit of data we have would indicate that their biggest gain is going to be going to a single payer system. And my suggestion, respectful to them, would be that trying to get there incrementally is like trying to cross a chasm in 2 steps. And if they did that alone, they would be looking at 25 to 30% savings, monetary savings in the system, which would provide all kinds of opportunities for innovations and so on.
Fundamentally, I think that there is a recognition on the part of many Americans that access to healthcare should be a human right, and that it's not a market good to be traded like any other commodity. But somehow the system has taken on a life of its own in that country, and it's very difficult to get a handle on. I think my primary message to the people of the United States is that I really believe this is a time for courage, and it's not a moment to take tiny steps or baby steps, but that it seems to me that the American population has indicated a readiness for a real change in the way that the healthcare system works, and they need to grasp that opportunity now and go for change with a capital C.
You know what I would do? I would sum it up in 3 words if I was President Obama, so pretentious for me to say. I'd get up every morning and at every press conference say, Medicare for everyone. Now, in the United States, Medicare, of course, deals with that program, which is basically reserved for seniors 65 years of age and over. They love it. They know it works. It's a government plan. It's not identical to Canada's, but they would not want to see it gone. And I think that those who don't have Medicare, because they're not there at age yet, and those on Medicaid, on welfare, who are really the victims of all of this, and the whole system seems to be victimizing its people, that would resonate with them. It would mean something. Medicare for everyone. You can attach the other arguments, moral arguments, and also economic and political arguments. It's the right thing to do. A society should look after its least strong, its most vulnerable sectors. But Medicare for everyone. And if I would be so presumptuous, one last comment. No major battle of this nature, as we had in Saskatchewan when Douglas implemented Medicare, as Pearson had it when he implemented Medicare, as Trudeau had it when he had the Canada Health Act. No major political battle can be won without strong, decisive leadership at the top political level, making the message clear and the argument solid as to why their citizenry should support it.
Oh!